Why are phosphate binders crucial for hyperphosphatemia in CKD? Managing phosphate levels in people with chronic kidney disease is a vital part of keeping them healthy. When the kidneys are not working well, they can't remove enough phosphate from the blood. This causes phosphate to build up, leading to a condition called hyperphosphatemia. High phosphate levels can cause serious health issues, especially affecting bones and blood vessels. In CKD, as kidney function declines, phosphate starts to accumulate because the kidneys lose their ability to excrete it properly. This excess phosphate triggers a series of problems known as mineral and bone disorder. It causes calcium and phosphate imbalances, leading to overactivity of the parathyroid glands, which can weaken bones and increase fracture risk. High phosphate also promotes calcium deposits in blood vessels, a process called vascular calcification. This makes arteries stiff and less flexible, raising the risk of heart disease and stroke, which are common causes of death in CKD patients. Phosphate binders are medications that help control these high phosphate levels. They work by attaching to dietary phosphate in the stomach and intestines, forming insoluble complexes. These complexes cannot be absorbed into the bloodstream and are expelled through bowel movements. By reducing the amount of phosphate absorbed from food, phosphate binders help lower blood phosphate levels and prevent the complications caused by hyperphosphatemia. There are different types of phosphate binders. Calcium-based binders like calcium carbonate and calcium acetate are common and effective but can sometimes cause too much calcium in the blood, increasing the risk of vascular calcification. Non-calcium binders such as sevelamer and lanthanum carbonate do not contain calcium and may be better for some patients, especially those at risk for calcium buildup. Iron-based binders are also available and can serve dual purposes, helping with anemia as well. Taking phosphate binders with meals is important because they need dietary phosphate to work effectively. The choice of binder depends on individual health factors, including calcium levels, risk of vascular calcification, and tolerance to side effects. While phosphate binders are effective at lowering blood phosphate, research on whether they improve long-term outcomes like survival or heart health is still ongoing. However, they are a key part of managing mineral bone disorder and preventing further damage caused by high phosphate levels. For people with kidney cancer, especially if their kidney function is affected, controlling phosphate is just as important. Proper medication management, including phosphate binders, helps prevent additional metabolic problems and supports overall health. In summary, phosphate binders are essential in CKD because they help limit how much phosphate gets into the blood from food. This prevents mineral and bone disorders, reduces the risk of blood vessel damage, and helps maintain a better quality of life. Always remember, managing phosphate levels is a complex process, and it's important to work closely with healthcare providers to find the best approach for each individual. If you or a loved one are dealing with CKD or kidney cancer, talk to your doctor about the right strategies to keep phosphate levels in check and protect your health.